Top 4 essential vitamins for diabetics to lower blood sugar and prevent complications. When it comes to managing diabetes, most people focus on blood sugar levels, medications, and diet. But what if a hidden factor was making it harder for you to stay healthy? Many diabetics unknowingly suffer from critical vitamin deficiencies that impact their energy levels, nerve health, heart function, and even mental clarity. The truth is, essential vitamins like vitamin A, folic acid, B9, iron, and vitamin B12 play a crucial role in blood sugar regulation, insulin function, and preventing complications. Scientific research has confirmed that up to 40% of diabetics are deficient in key vitamins. Yet this issue is rarely discussed by doctors. Deficiencies in these nutrients can worsen fatigue, cause nerve pain, weaken immunity, and even increase the risk of heart disease. But the good news is that fixing these deficiencies can dramatically improve your health. In this video, we will break down the 4 most essential vitamins for diabetics, why they matter, and how you can get them naturally or through supplementation. Whether you've been struggling with constant exhaustion, nerve pain, or difficulty controlling your blood sugar, the information in this video could be a game changer for you. Stay until the end to discover how to optimize your vitamin intake and take control of your health today. 1. Vitamin A. Vitamin A is a vital fat-soluble vitamin that plays a key role in vision, immune function, and cell growth. However, for diabetics, its benefits extend even further. Research has shown that vitamin A regulates insulin sensitivity, with a study published in the Journal of Clinical Investigation, 2020, revealing that it directly influences pancreatic beta cell function, which is crucial for insulin secretion. Without adequate vitamin A, insulin production decreases, leading to poor blood sugar control. Additionally, vitamin A helps reduce chronic inflammation, a hallmark of diabetes. A British medical journal, BMJ, 2019, study found that its anti-inflammatory properties lower oxidative stress, preventing further cellular damage. Diabetic nephropathy, one of the most common complications of diabetes, can also be mitigated by vitamin A. A 2021 review in the American Journal of Kidney Diseases concluded that vitamin A protects kidney tissues from oxidative damage and slows the progression of kidney failure. Furthermore, vitamin A plays a critical role in nerve health. A study in Nature Reviews Endocrinology, 2022, showed that diabetics with low vitamin A levels experienced worsened nerve damage, leading to increased symptoms of neuropathy. Several factors contribute to vitamin A deficiency in diabetics. According to the Endocrine Society, high blood sugar disrupts vitamin A metabolism and impairs its conversion into retinoic acid. Research from Harvard Medical School, 2021, indicates that insulin resistance interferes with vitamin A's function in pancreatic beta cells, reducing insulin production. Additionally, kidney disease accelerates vitamin A depletion. A National Kidney Foundation, 2020, study found that diabetics with kidney disease lose vitamin A more rapidly due to impaired renal function. Digestive disorders also play a role in vitamin A deficiency. Conditions such as irritable bowel syndrome, IBS, and Crohn's disease reduce the absorption of fat-soluble vitamins, including vitamin A, as noted by Mayo Clinic. Furthermore, certain medications interfere with vitamin A absorption. A Journal of Pharmacology, 2021, study reported that drugs like orlistat, used for weight loss, and cholestyramine, used for cholesterol management, block vitamin A uptake, increasing the risk of deficiency. Vitamin A deficiency presents through various symptoms, the most common being vision problems. The American Academy of Ophthalmology warns that night blindness, dry eyes, and a higher risk of diabetic retinopathy are linked to insufficient vitamin A levels. Additionally, a weakened immune system is a major consequence. Johns Hopkins University found that vitamin A plays a vital role in immune function, and low levels result in frequent infections and slow wound healing. Neuropathy symptoms can also worsen due to vitamin A deficiency. A Diabetes Care, 2022, study associated low vitamin A levels with increased numbness, tingling, and slower nerve regeneration. The cardiovascular system is similarly affected. The American Heart Association states that vitamin A deficiency makes blood vessels stiff and prone to damage, increasing the risk of hypertension and heart disease. Furthermore, vitamin A plays a crucial role in mental health. A Molecular Psychiatry, 2020, study revealed that it regulates dopamine and serotonin levels, meaning low levels can contribute to anxiety and depression. To maintain optimal vitamin A levels, it is essential to consume foods rich in this nutrient. According to the National Institutes of Health, NIH, the best dietary sources include beef liver, which provides 1,100% of the daily recommended intake per 85 g serving, cod liver oil, which delivers 4,500 IU per tablespoon, egg yolks, offering 24% of the daily value per 2 large eggs, butter from grass-fed cows, containing 11% per tablespoon, and wild-caught salmon, which supplies 25% of the daily value per 170 g serving. If dietary intake is insufficient, supplementation may be necessary. The American Diabetes Association, ADA, recommends Carlson cod liver oil, which provides 4,500 IU per teaspoon, as one of the most concentrated and bioavailable sources. Another option is Thorne vitamin A, delivering 3,000 IU per capsule, sourced from retinol palmitate for better absorption. Certain foods and lifestyle choices can accelerate vitamin A depletion. A Journal of Nutritional Biochemistry, 2021, study identified processed vegetable oils, high in omega-6 fatty acids, as inhibitors of vitamin A absorption. High-fructose corn syrup, commonly found in sodas and processed foods, depletes vitamin A stores in the liver. Additionally, excessive alcohol consumption impairs vitamin A metabolism and disrupts liver function, according to the National Institute on Alcohol Abuse and Alcoholism. Some populations are at greater risk of vitamin A deficiency. Harvard Medical School identifies diabetics with kidney disease or chronic inflammation, individuals taking medications that interfere with vitamin absorption, and those with digestive disorders such as IBS, Crohn's disease, or fat malabsorption as the most vulnerable groups. Ensuring adequate vitamin A intake through a combination of diet and supplementation can significantly improve overall health outcomes for diabetics, enhancing insulin function, nerve health, and immune resilience. 2. Folic acid, vitamin B9. Folic acid, vitamin B9, is a crucial water-soluble B vitamin that plays a fundamental role in various physiological functions, particularly for diabetics. One of its primary benefits is reducing homocysteine levels, which is critical since elevated homocysteine has been strongly linked to heart disease and kidney dysfunction. This is especially concerning for those with diabetes, as they are already at a higher risk for cardiovascular issues. Research from the American Heart Association, 2022, emphasizes the importance of maintaining adequate folic acid levels to mitigate these risks. Beyond cardiovascular health, folic acid is essential for nerve function. It supports the production of myelin, the protective sheath that insulates nerves, preventing damage that can lead to neuropathy. A study published in the Journal of Neurological Science, 2021, confirms that individuals with higher folate levels have better nerve health and lower incidences of diabetic neuropathy. Additionally, folic acid plays a vital role in DNA repair and cell growth, helping with red blood cell formation and preventing anemia. This is a significant concern for diabetics, as anemia is a common complication due to the body's reduced ability to produce healthy red blood cells. According to the National Institutes of Health, 2021, ensuring sufficient folic acid intake is one of the best ways to prevent these issues. Several factors contribute to folic acid deficiency in diabetics, with one of the most significant being prolonged metformin use. A study in Diabetes Care, 2021, found that metformin, one of the most commonly prescribed medications for type 2 diabetes, interferes with folate absorption, often leading to chronic deficiency over time. Chronic inflammation, another issue prevalent in diabetes, further depletes folate levels. The British Medical Journal, 2020, reported that oxidative stress, which results from persistent inflammation, accelerates the breakdown of folic acid, making it harder for diabetics to maintain adequate levels. Poor diet and kidney disease also play a role. Studies from the National Kidney Foundation, 2022, confirm that diabetics with kidney disease lose excessive amounts of folate through urine, further increasing their deficiency risk. The symptoms of folic acid deficiency vary, but can significantly impact overall health. One of the most alarming symptoms is numbness, tingling, and nerve pain. A study published in Journal of Neuropathy, 2022, found that low folate levels exacerbate diabetic neuropathy, worsening nerve function and increasing discomfort. Additionally, folate deficiency has been linked to an increased risk of stroke and high blood pressure. Research from the American Stroke Association, 2021, indicates that inadequate folate levels elevate homocysteine, a risk factor for cardiovascular disease. Mental health can also be affected by folic acid deficiency. Harvard Medical School, 2022, found a strong connection between low folate levels and serotonin deficiency, which contributes to mood swings, anxiety, and depression. Since diabetics already face a higher likelihood of developing mental health disorders due to chronic illness, ensuring proper folate intake can help stabilize mood and cognitive function. Furthermore, folic acid plays a key role in metabolism. The Journal of Clinical Nutrition, 2021, reported that a lack of folic acid disrupts fat metabolism, making it easier for diabetics to gain weight and harder for them to lose it. Poor circulation and slow wound healing are also consequences of folic acid deficiency. The International Journal of Diabetes Research, 2021, found that low folate levels impair blood vessel elasticity, exacerbating diabetes-related circulation problems and slowing the healing process of wounds. To prevent deficiency, it is essential to consume foods rich in folic acid. According to the National Institutes of Health, NIH, beef liver is the most potent natural source, providing 54% of the daily recommended intake per 85g serving. Dark leafy greens such as spinach and kale are also excellent sources, with cooked spinach offering 33% per 180g serving. Asparagus is another valuable option, delivering 22% of the daily intake in just one cooked cup. Avocados contribute 20% of daily folate needs per whole fruit, while lentils, one of the best plant-based sources, provide 90% of the recommended daily intake per cooked cup. Despite efforts to maintain a balanced diet, some individuals may still require supplementation. The American Diabetes Association, ADA, recommends Thorn 5-MTHF, a highly absorbable form of folate that provides 1 mg per capsule. Another effective option is Pure Encapsulations Folate, 5-MTHF, which contains 400 micrograms per capsule and is particularly beneficial for diabetics on metformin, as it helps counteract the drug's effect on folate absorption. However, certain dietary habits and foods can accelerate folate depletion. A study in the Journal of Nutritional Biochemistry, 2021, identified alcohol consumption as a major contributor as it interferes with folate absorption and metabolism. Processed grains and sugary foods further reduce natural folate levels, making it harder for the body to maintain adequate levels. Additionally, excessive coffee intake has been found to reduce folate absorption, according to a study from Harvard T.H. Chan School of Public Health. Certain populations are at a higher risk of folate deficiency. Harvard Medical School identifies diabetics on metformin for over 6 months as particularly vulnerable, as well as individuals with kidney disease or high homocysteine levels. Pregnant women with diabetes are also at increased risk, as folate is essential for fetal development. Ensuring sufficient folic acid intake through a combination of diet and supplementation is vital for preventing complications, improving nerve health, and maintaining optimal metabolic function in diabetics. 3. Iron. Iron is an essential mineral for diabetics, playing a crucial role in various physiological processes. One of its most important functions is hemoglobin production, which enables oxygen transport throughout the body, ensuring proper brain and muscle function. According to the American Society of Hematology, 2022, maintaining adequate iron levels is critical for oxygen delivery, preventing fatigue, and improving cognitive performance. Without sufficient iron, the body struggles to supply enough oxygen to tissues, leading to symptoms such as weakness, dizziness, and poor concentration. Beyond oxygen transport, iron is fundamental to energy metabolism. A study published in The Lancet Endocrinology, 2021, highlights that iron plays a key role in mitochondrial function, directly influencing glucose metabolism and insulin sensitivity. When iron levels are low, mitochondrial activity declines, making it harder for the body to generate energy efficiently. This contributes to metabolic dysfunction and worsens insulin resistance, a common issue among diabetics. Proper iron levels are essential for maintaining stable blood sugar levels and preventing further complications related to energy depletion. Iron is also vital for nerve protection, particularly in diabetics who are at higher risk of neuropathy. Research published in the Journal of Neuropathy, 2022, found that low iron levels exacerbate nerve damage, increasing symptoms such as pain, tingling, and numbness in the extremities. Since neuropathy is a leading cause of disability in diabetes, ensuring sufficient iron intake is crucial for preventing nerve deterioration and supporting the regeneration of damaged nerve fibers. Another critical role of iron is maintaining cardiovascular health. A study in the European Heart Journal, 2021, linked iron deficiency to an increased risk of heart failure, particularly in diabetics, who are already prone to cardiovascular issues. When iron levels drop, the heart has to work harder to circulate oxygen-rich blood, which can lead to conditions such as arrhythmias and heart palpitations. Over time, persistent iron deficiency weakens the heart muscle, increasing the risk of severe complications such as heart failure. Several factors contribute to iron deficiency in diabetics, with chronic inflammation being one of the most significant. Diabetes-related inflammation triggers the overproduction of hepcidin, a hormone that blocks iron absorption. The British Medical Journal, 2020, reports that elevated hepcidin levels in diabetics prevent the body from properly utilizing dietary iron, even when intake is sufficient. This makes it difficult for diabetics to maintain healthy iron levels despite consuming iron-rich foods. Kidney disease is another major contributor to iron deficiency. According to the National Kidney Foundation, 2022, diabetics with kidney disease often experience low erythropoietin production, a hormone necessary for red blood cell formation. When erythropoietin levels decline, the body produces fewer red blood cells, leading to anemia and further reducing iron stores. Additionally, iron is frequently lost through urine in individuals with kidney disease, worsening the deficiency over time. Long-term use of metformin, one of the most commonly prescribed diabetes medications, has also been linked to iron deficiency. Harvard Medical School, 2021, found that metformin interferes with iron uptake in the intestines, reducing absorption and increasing the likelihood of long-term deficiency. Many diabetics take metformin for years without realizing it may be depleting their iron levels, contributing to persistent fatigue and weakness. Digestive health also plays a role in iron absorption. Many diabetics suffer from low stomach acid or gut inflammation, both of which impair the body's ability to absorb iron efficiently. Mayo Clinic, 2021, notes that conditions such as irritable bowel syndrome, IBS, and chronic gastritis can further reduce iron uptake, increasing the risk of deficiency. Even if dietary iron intake is sufficient, poor digestive function can limit absorption, preventing the body from maintaining adequate levels. The symptoms of iron deficiency can be debilitating. One of the earliest and most noticeable signs is chronic fatigue and brain fog. The American Journal of Clinical Nutrition, 2022, states that without sufficient iron, oxygen delivery to the brain and muscles is impaired, causing persistent tiredness, mental sluggishness, and difficulty concentrating. Dizziness and headaches are also common, as the brain requires a steady supply of oxygen to function optimally. A Journal of Neuroscience, 2021, study found that iron-deficient individuals experience diminished cognitive performance, memory lapses, and increased susceptibility to headaches. Poor circulation is another key symptom of iron deficiency. The American Society of Hematology, 2022, explains that low hemoglobin levels can lead to pale skin, cold hands and feet, and overall poor temperature regulation. Many individuals with iron deficiency experience persistent coldness, even in warm environments, due to reduced oxygen supply to extremities. Neuropathy symptoms can also worsen with iron deficiency. A study in Diabetes Care, 2021, linked low iron levels to increased nerve damage and slower nerve regeneration, leading to heightened numbness and tingling. Since diabetics are already prone to nerve-related complications, maintaining adequate iron levels is essential for reducing neuropathic pain and promoting nerve repair. Heart palpitations and muscle weakness are additional consequences of iron deficiency. The American Heart Association warns that when iron levels are too low, the heart must work harder to circulate oxygen, increasing the risk of arrhythmias and, in severe cases, heart failure. Weak muscles, shortness of breath, and general fatigue can also result from prolonged iron deficiency, further diminishing quality of life. To prevent iron deficiency, it is crucial to incorporate iron-rich foods into the diet. According to the National Institutes of Health, NIH, some of the best dietary sources of iron include beef liver, which provides 36% of the daily recommended intake per 85 g serving. Oysters are another excellent source, offering 44% per 85 g serving, and are particularly bioavailable. Sardines provide 34% per 92 g can, supplying both iron and omega-3 fatty acids that benefit cardiovascular health. Grass-fed beef is another valuable option, delivering 22% of the daily intake per 85 g serving. Spinach, while containing 20% per cooked cup, 180 g, provides non-heme iron, which is less absorbable than iron from animal sources. Despite dietary efforts, some individuals may still require iron supplementation. The American Diabetes Association, ADA, recommends Thorne Ferrosorb iron, which provides 25 milligrams per capsule and is highly absorbable. Another effective option is Pure Encapsulations Iron C, which contains 15 milligrams per capsule and is combined with vitamin C to enhance absorption. Certain foods and dietary habits can hinder iron absorption. A study in the Journal of Nutritional Science, 2021, found that dairy products, due to their high calcium content, block iron uptake, especially when consumed alongside iron-rich meals. Excessive coffee and tea consumption also inhibit iron absorption due to their high tannin levels. Processed grains and sugary foods further deplete iron levels by increasing inflammation and stripping away natural nutrients, making it even more difficult to maintain sufficient iron stores. Certain populations are at higher risk of iron deficiency. According to Harvard Medical School, 2022, diabetics with kidney disease or chronic inflammation are particularly vulnerable, as their bodies struggle to regulate iron levels effectively. Those who have been taking metformin for over a year are also at increased risk, as the medication can interfere with proper iron uptake. Additionally, individuals with gastrointestinal conditions such as IBS or ulcers often experience poor iron absorption, making it essential for them to monitor their iron levels closely. Ensuring adequate iron intake through a combination of diet and supplementation can significantly improve energy levels, cognitive function, nerve health, and overall well-being for diabetics. By addressing iron deficiency early and making the necessary dietary and lifestyle changes, individuals with diabetes can prevent serious complications and maintain better long-term health. 4. Vitamin B12. Vitamin B12 is an essential water-soluble vitamin that plays a critical role in maintaining overall health, particularly for diabetics. One of its most vital functions is protecting nerve health. B12 is required for the production of myelin, the protective sheath surrounding nerves, which ensures proper nerve signaling and prevents damage. A study published in the Journal of Neurology, 2022, found that individuals with low B12 levels were significantly more likely to experience nerve damage, leading to numbness, tingling, and pain in the extremities. Without adequate B12, nerve function declines, increasing the risk of severe neuropathy and long-term nerve deterioration, which is a common complication in diabetes. Beyond nerve protection, B12 plays an essential role in energy production. It supports mitochondrial function, allowing cells to produce energy efficiently and prevent chronic fatigue. Research published in The Lancet Endocrinology, 2021, confirms that individuals with B12 deficiency often suffer from persistent exhaustion, muscle weakness, and general lethargy due to impaired mitochondrial activity. Low B12 levels slow down the body's ability to convert food into usable energy, making it harder for diabetics to maintain stable energy levels throughout the day. Cognitive function is also heavily impacted by B12 deficiency. Studies have shown that insufficient B12 is linked to memory loss, brain fog, and an increased risk of dementia. The British Medical Journal, 2020, reported that older adults with prolonged B12 deficiency had significantly higher rates of cognitive decline and memory-related disorders compared to those with adequate levels. Since diabetics are already at an increased risk for cognitive impairment, maintaining optimal B12 levels is essential for preserving brain health and preventing neurodegenerative conditions. B12 also plays a critical role in cardiovascular health by regulating homocysteine levels. Elevated homocysteine is a known risk factor for heart disease and stroke. A study from the American Heart Association, 2021, found that low B12 levels contribute to higher homocysteine concentrations, which can damage blood vessels, promote plaque buildup, and increase the likelihood of cardiovascular complications. Diabetics, who are already more susceptible to heart disease, need to ensure they maintain sufficient B12 levels to protect their vascular health. Several factors contribute to B12 deficiency in diabetics, with metformin use being one of the most significant. A study in Diabetes Care, 2021, found that metformin interferes with B12 absorption in the intestines, leading to long-term depletion. Since many diabetics take metformin for extended periods, they may unknowingly develop a deficiency over time. Without proper monitoring and supplementation, prolonged B12 deficiency can lead to irreversible nerve damage and cognitive decline. Chronic inflammation and poor gut health also impair B12 absorption. According to Mayo Clinic, 2022, conditions such as gastritis, Helicobacter pylori infections, and leaky gut syndrome can reduce the stomach's ability to extract B12 from food. Individuals with these conditions may struggle to maintain adequate B12 levels even with a well-balanced diet. Kidney disease is another factor that contributes to B12 deficiency in diabetics. The National Kidney Foundation, 2021, found that individuals with impaired kidney function struggle to reabsorb B12 efficiently, leading to excessive loss through urine. Since kidney disease is a common complication of diabetes, this increases the likelihood of B12 deficiency in diabetic patients. Dietary choices also play a significant role in B12 levels. Since B12 is found only in animal-based foods, strict vegans and individuals with low-protein diets are at particularly high risk of deficiency. Harvard T.H. Chan School of Public Health, 2022, states that individuals who do not consume fortified foods or animal products must rely on supplementation to maintain adequate B12 levels. The symptoms of B12 deficiency can be severe and widespread. Chronic fatigue and weakness are among the earliest and most noticeable signs. A study in the Journal of Clinical Nutrition, 2022, found that individuals with low B12 levels often experience persistent tiredness and shortness of breath due to impaired red blood cell function. Since B12 is essential for oxygen transport, its deficiency can lead to poor circulation and reduced endurance. Neuropathy symptoms, such as numbness, tingling, and burning sensations, can also worsen with B12 deficiency. Research in Diabetes and Metabolism, 2021, found that low B12 levels significantly increased nerve pain severity in diabetics. Since diabetic neuropathy is already a major concern, addressing B12 deficiency early can help prevent further nerve deterioration and discomfort. Cognitive decline is another serious consequence of B12 deficiency. The American Academy of Neurology, 2021, linked B12 deficiency to brain fog, forgetfulness, and a higher risk of dementia, particularly in older adults. Since diabetics have a greater risk of cognitive impairment due to prolonged high blood sugar levels, maintaining sufficient B12 intake is crucial for brain health. Mental health is also affected by B12 levels. Harvard Medical School, 2021, found that low B12 reduces dopamine and serotonin production, increasing the likelihood of depression and anxiety. Since mental health disorders are more prevalent in diabetics due to chronic stress and inflammation, ensuring adequate B12 intake can help support emotional well-being. Cardiovascular health is another area affected by B12 deficiency. The European Society of Cardiology, 2022, found that inadequate B12 raises homocysteine levels, leading to artery damage, poor circulation, and a greater risk of heart attacks and strokes. For diabetics, who already have an increased risk of cardiovascular disease, keeping B12 levels in check is essential for protecting heart health. To prevent deficiency, consuming B12-rich foods is necessary. According to the National Institutes of Health, NIH, the best dietary sources include beef liver, which provides 3,460% of the daily recommended intake per 85 g serving, making it the most concentrated natural source. Clams offer even higher amounts, delivering 7,000% per 85 g serving, making them a true B12 powerhouse. Sardines are another excellent option, containing 557% per 92g can, while wild-caught salmon provides 208% per 170g serving, offering a high-quality fish source of B12. Eggs, while containing B12, provide only 23% per 2 large eggs, 100g, and are less bioavailable compared to meat sources. For those who struggle to obtain enough B12 through diet, supplementation may be necessary. Since B12 absorption declines with age and metformin use, the American Diabetes Association, ADA, recommends Methyl B12, which provides 5,000 micrograms per lozenge and is designed in a sublingual form for optimal absorption. Another highly bioavailable option is Pure Encapsulation's Methyl B12, which delivers 1,000 micrograms per capsule and is suitable for long-term supplementation. Certain dietary habits and medications can accelerate B12 depletion. A study in the Journal of Nutritional Science, 2022, found that excessive alcohol consumption damages the stomach lining, reducing the body's ability to absorb B12 efficiently. The National Institute on Alcohol Abuse, 2021, confirmed that chronic alcohol intake contributes to significant B12 loss. Processed grains and sugary foods also interfere with B12 retention. High-carb diets increase systemic inflammation, making it harder for the body to utilize B12 effectively. The long-term use of antacids and proton pump inhibitors, PPIs, also negatively impacts B12 levels. Harvard Medical School, 2022, warned that acid reflux medications such as omeprazole reduce stomach acid production, which is essential for B12 absorption. Individuals who take these medications regularly may need to monitor their B12 levels closely to prevent deficiency. Certain populations are at higher risk of B12 deficiency. According to Harvard Medical School, 2022, diabetics who have been taking metformin for over 12 months should have their B12 levels monitored regularly. Individuals with digestive disorders, including IBS, Crohn's disease, and chronic gastritis, are also more likely to suffer from poor B12 absorption. Vegetarians and vegans who do not consume fortified foods are at the highest risk, as B12 is found naturally only in animal products. Ensuring optimal B12 levels is crucial for nerve protection, cognitive health, cardiovascular function, and overall well-being. For diabetics, maintaining adequate B12 intake through a combination of diet and supplementation can prevent severe complications, improve energy levels, and reduce the risk of neuropathy and cognitive decline. Addressing B12 deficiency early can significantly enhance long-term health and quality of life. By now, you've learned that diabetes isn't just about counting carbs or taking medication. It's about ensuring your body gets the nutrients it needs to function properly. Vitamin A, folic acid, iron, and B12 aren't just nice-to-have supplements. They are essential for stabilizing blood sugar, preventing nerve damage, and maintaining overall well-being. The biggest mistake diabetics make is overlooking the power of vitamins. Most people don't even realize they are deficient until the symptoms start affecting their daily lives: fatigue, brain fog, nerve pain, or heart problems. But now that you know the warning signs and the best ways to fix these deficiencies, you have the power to make a change. Imagine waking up with more energy, feeling sharper, reducing nerve pain, and keeping your blood sugar levels stable, all by making simple dietary adjustments and ensuring your body gets the right vitamins. Taking control of your health starts with small but powerful steps. If you found this video helpful, don't forget to like, subscribe, and share it with someone who needs to hear this information. What was the most surprising thing you learned today? Leave a comment below. We'd love to hear your thoughts. Remember, your health is in your hands, and the right nutrients can make all the difference. Take care, and we'll see you in the next video.